one.
Hello everyone. So today we're going to talk about smoking in Vietnam.
Okay.
So for the major health concerns, smoking culture are strongly formed by social environments such as family, social economic status, peers, and also the minority groups have lower levels of knowledge regarding the harmful effects of smoking. People that are affected by secondhand smoke followed by the lack of designated smoking areas we can easily see in public elevators, school campus, public transportation, and also the average price of a pack in Vietnam is between $1 to $2, and they have the lower tax rate applied to the cigarette sales. Low-income population also deal with daily stress, and they have poor management on checking IDs when they sell the cigarettes, and also seller need monies to handle cost of living. Smoking also considered as a socialization to maintain connections even in the professional life and seen as a way to bond with each bond with others and they have easy access to buy cigarettes. Next. For the statistic, 1 in 2 Vietnamese men smoke cigarettes, placing them among the highest tobacco consumer in the world. The study report that roughly 50% of adults are smokers and 85% of them smoke daily. 55.9 consume at least half of a pack a day and 37.6 use the entire pack. They form daily habit by the age of 18, and Vietnam ranked in the top 15 countries to the highest rate of tobacco use. 40,000 people die each year, which is 4 times higher than the traffic accident death toll. And secondhand smoke also face with an increased risk of heart disease and stroke. Next.
So some organizations that addresses this issue is the Vietnam Steering Committee on Smoking and Health, otherwise known as VINICOSH. It's a governmental organization responsible for coordinating efforts relating to tobacco control in Vietnam. It was established in the 1990s to oversee and coordinate tobacco control activities in Vietnam. Um, Another organization is World Health Organization, or WHO of Vietnam, who collaborates with the Vietnamese government and other stakeholders to support tobacco control policies and programs. In 2004, Vietnam ratified the FCTC, which is an international treaty aimed at reducing tobacco-related harms globally. Who Vietnam played a crucial role in supporting Vietnam's commitment to implementing FCTC provisions. So continued more organizations that support preventing smoking in Vietnam. It would be the Vietnam Public Health Association, or VPHA. It's a social and professional association which now assumes a leading role in the tobacco control working group. Um, VPH, VPHA main function is evidence-based advocacy for new policies or implementation of existing policies, including tobacco control, through pilot projects and research. They're in a unique position as a result of connections. It's a capacity to link tobacco control advocates to high-ranking policymakers, giving them channels to access and approach the National Assembly members. Um, so that means that its position is like invaluable to the tobacco control working group. And the last organization, to name a few, is the Vietnamese Health Environment Management Agency. It's dedicated to promoting and enforcing tobacco control measures to create a healthier environment for all Vietnamese citizens. In 2013, they were public health nonprofit organization that were one of the organizations to involve in the law on prevention and control in tobacco harms. They advocated for 100% smoke-free environments for virtually all public places and workplaces. And they also advocated for prohibition of tobacco sales within 100 meters of educational and healthcare facilities.
And here's a slide comparing Vietnam to the Bahamas. So we're going to look at this chart right here comparing between these two countries. Vietnam is considered the low-income country, and the Bahamas is considered the high income. So both have good developmental status. However, when we look at Vietnam and their total expenditure on health as percentage of their GDP, Vietnam has 4.6%, whereas the Bahamas, they have 7.59%. Looking at the gross national income per capita, Vietnam has $12,810 PPP, while the Bahamas has $38,820 PPP. In terms of their per capita expenditure on health, Vietnam spends $166.20, and the Bahamas spends $1,851. Looking at their infant mortality rate, Vietnam has 15.627 deaths per 1,000 births, while the Bahamas, they have 5.348 deaths. Looking at the life expectancy, Vietnam is expected, the average lifespan is about 73.7 years, and the Bahamas is a little bit lower at 73.2 years. And both countries have access to water. So this slide is summing up the information between the two countries. The Bahamas, they favor better in expenditures on health, gross national income per capita expenditure on health, and infant mortality rate over Vietnam. However, Vietnam does favor better in having a slightly longer life expectancy, and it can be seen in these two graphs right here.
So for nursing intervention, there are three levels of prevention. First one is primary prevention. There's public awareness campaigns, launching comprehensive public awareness campaigns to educate the population about the dangers of smoking, the health risk associated with it, and the benefits of quitting. There's also school-based programs, implementing anti-smoking education programs in school to educate children and adolescents about the harms of tobacco use and to promote healthy lifestyle. And there's also tobacco control policies, enforcing strict tobacco control policies such as advertising bans, smoke-free laws, and taxation on tobacco products to reduce the availability and accessibility of cigarettes. And for secondary prevention, screening and counseling, offering smoking cessation services in healthcare facilities where individuals can receive screening for tobacco use and counseling for quitting, and community support groups, establishing community-based support groups and hotlines where smokers can seek assistance and support from peers and trained counselors to quit smoking, and workplace intervention, implementing smoke-free workplace policies and providing resources and support for employees who want to quit smoking. And for tertiary prevention, treatment programs, providing access to evidence-based treatment programs such as nicotine replacement therapy, behavioral therapy, and pharmacotherapy to help smokers quit successfully, and post-quit support, offering a follow-up support and relapse prevention programs to individuals who have successfully quit smoking to help them maintain the smoke-free status, and the healthcare integration, integrating tobacco cessation services into routine healthcare services to ensure that smokers receive support and guidance from healthcare professionals during their visits. Next.
The EPI triad is a model used to explain the occurrence of the disease and is considered of three component agent, host, and the environment. In the context of smoking in Vietnam, the agent is the tobacco products, which contains nicotine and other harmful chemicals. The host is the individual who uses the tobacco product, and their susceptibility to the harmful effect of smoking is influenced by factors such as age, gender, and genetic makeup. The environment includes external factors that can influence the likelihood of smoking and the severity of its effects. In Vietnam, these environmental factors may include cultural norms around smoking, access to tobacco products, and exposure to secondhand smoke. To reduce the burden of smoking-related diseases in Vietnam, intervention may need to address all three components of the EPI triad.
Okay. And here we can look at a model that helps to promote people's health, which is the Pender's health promotion model. And the goal is to have people do health promoting behavior. Something that we have to focus on is that people do have to want to change and do behaviors that help them be healthy, that they're able to interact with their environment, and that there are healthcare professionals that are involved and are able to influence their decisions. And lastly, that a person is willing and able to change how they interact with the surrounding environment, whether that's family, whether that's businesses, or anything else, to be able to make those health promoting behavioral changes that we're going to be discussing here. Next slide, please. So first things that we can look for is perceived cost or benefit to changing some of these behaviors. So one of the major things that is going to be the benefit for these changes of not smoking would be improved respiratory health, improved cardiac health, overall feeling of well-being. Those are all benefits for people actually making those behavioral changes. But there's also a lot of possible barriers, and those can be social, psychological, number of different things. Major ones that we have to look at as well is going to be the social ones here, because there's a huge smoking culture in Vietnam that promotes having smoking as a social activity. There's a lot of peer pressure, there's a lot of activities that involve this, where people may feel like they're actually missing out on being able to be around friends, have good relationships and good moments. And all of those are going to pose barriers to someone wanting to have those health promoting behaviors. We can also look at whether or not someone can believe they're going to be successful with these changes, which will impact whether or not they're going to start making those behavioral changes. Because if they don't think they're going to be successful, they're not going to even start with that process. And then also the activity related effects on both sides. One would be making those changes is overall healthier for the person, but it could also be the detriments that we discussed earlier. There's also the interpersonal influences such as family and peers that have to be considered, which are really important. If everyone around them is smoking as well, that may also make it a lot more difficult for someone to make a behavioral change and do the health promoting behavior that is more optimal and better for them. And then we also have to look at situational influences such as parties, events, weddings, anything of that sort that also promotes smoking as an activity that's social, fun, or exciting is also going to be another barrier for someone to make those changes. Because of all of this, there's a huge prevalence of people needing to make personal decisions to change how they interact with their environment, because there's so much in the environment for Vietnamese culture that promotes smoking. So they're going to have to put a lot of personal effort, as well as going out to get information about smoking and that it is not healthy for them, and how they can change their behaviors in a positive way and still be involved in their communities. That means that they're going to have to go out of their way to talk with the public health department that we discussed earlier, that they're going to have to get lots of information. So having healthcare professionals be more involved in this area is going to be extremely important for education and support, not only directly in terms of medical, but also as social support to be able to give advice and help with ways to interact with people in a way that's healthy and meaningful to them still, without having to involve smoking with it.